Hi everyone, Rachel here from North Brisbane Psychologists. I have been asked a question through our website about what do you do when you're a parent of young adult children who have failed to launch. That is, they are still living at home, not behaving like a grown-up, not taking responsibility for themselves. So I thought I'd outline a few things that these poor long-suffering parents can do. First of all, we need to recognise a stage between adolescence and adulthood, which some psychologists call emerging adulthood. This is the stage of life between about 18 and 25, when actually your children's brains are still developing. Brains don't finish growing and developing until about the mid-20s, and then they're more able at that age to take the full responsibilities and self-sufficiency of adulthood. It's a tricky period, frustrating for parents when they just want to see their child be happy and be out there and getting an education, working or getting training and looking after themselves, and perhaps they're not. Perhaps they're unemployed, perhaps they've quit studying, perhaps they're drinking or smoking drugs or going out a lot or staying in their bedroom a lot. I've had a few of these clients. These parents are themselves often in their 50s, still working, getting close to retirement, and frightened that this is going to go on, this situation. So what can you do? So first of all, focus on the part of the problem that you can change. Stop trying so hard to change your young adult child and look after yourself. Take the focus back to you. Take the focus back to looking after yourself. Your role as caregiver is coming towards an end. You can still care, but you no longer need to take care of them predominantly because they're not a child anymore. So first of all, I would say self-care, self-care, self-care. Because otherwise it's very stressful, and the more stressed you get, the more you're going to try and control and change them, and the more they're going to resist that. So focus back on yourself again. Secondly, remember that your young adult child is not a full adult. Like I said before, their brain is still developing until their mid-20s. So, if you can sort of take the focus off them, of blaming them, of having conflict and arguments with them, that's actually going to help because, the arguments, the criticisms, the complaints that you make about them, as you've probably noticed, are not really influencing them in a positive way. Instead, open up a dialogue. Let them know how the situation is for you, how it affects you. That's fine. I mean, absolutely, when they're living at home and it's not what you expected it to be, then you need to let them know. I would suggest, just like you can do with teenagers and younger children, hold a family meeting. Clarify expectations. Write down the rules. You might make the rule that, there's no smoking pot in the household. There's no, inviting people over to stay the night without checking first. Whatever the rules are, whatever the boundaries, whatever the expectations, agree on these, explicitly write them down. Put them on the fridge. Make them clear. Also, I would say it's important to check if you're accommodating or enabling some of these behaviours. Sometimes you accidentally do this. You make their doctor's appointments, you do their laundry. They're 22 years old, they can do these things. Ask yourself, am I doing something for them that they could do for themselves? In fact, at 18, 19, 20, 21, they can do most things for themselves. So just check whether or not you're enabling their behaviour. And in terms of letting them do things for themselves, you might have to let them fail. If they fail to do things for themselves, let that happen. They need to sometimes experience that crisis, that loss of confidence, that failure, that mistake, that oversight, because pain is a powerful teacher, and we've all gone there, and we've all learned a lot from our failures and our pain, and as they say, you learn more from failures than from successes. So let them fail. Doesn't mean you don't care. You may need to seek some advice. This is why some of these parents have come to see us at North Brisbane Psychologists, to get a bit of support and help in managing their own thinking. Some CBT or other strategies for managing negative thinking and difficult emotions may help you stay more calm, which may help you deal with your young adult child more effectively. And of course, keep the compassion, keep the positivity, keep the love going as you're doing all of these things that I've listed above. So if you have any questions about this topic, please leave a comment below. And I hope this has been helpful to anyone out there with young adult children. See you soon.